Ghana falls within the world's high-burden malaria zone, but made a lot of progress in the fight against the disease. Over the past 10 years, Ghana has achieved 50% and 65% reductions in malaria inpatient cases and deaths respectively.
Malaria control has mainly two arms, the preventive side and the curative side.
Mostly this mosquito which transmits malaria, the female Anopheles mosquito, bites mostly from around 10 p.m. to early at dawn. That's why we promote insecticide-treated nets.
We have been working closely with the National Malaria Control Program, supporting their bed net distribution initiatives.
If we're able to prevent people from getting the disease, then our work is half done, because then the few that will get it will be treated.
The VectorWorks project focuses on continuous distribution, and what we mean by that is distribution of bed nets using channels other than mass campaigns.
The US President's Malaria Initiative PMI VectorWorks Ghana is a global malaria project. In Ghana, the project was implemented in partnership with the National Malaria Control Program, the Ghana Health Service, the School Health Education Program of the Ghana Education Service, and other US aid implementing partners to increase access to insecticide-treated nets using continuous distribution channels in basic schools and through health facilities across the country. Distributions by PMI VectorWorks Ghana is in three forms: antenatal and child welfare clinics, point mass distribution, and schools distribution.
Over the past 5 years, we have worked with bed net distribution in basic schools, targeting children in primary class 2 and primary class 6. And then also we have distributed through health facilities, specifically distributing nets to pregnant women who are reporting at the health facility for the very first time, what we call the registrants, and also to mothers of children receiving their measles 2 vaccination.
A total of over 33 million insecticide-treated nets have been distributed through various continuous distribution channels and mass campaigns from 2014 to 2019. This comprises over 3 million nets distributed through the schools distribution channel, over 4 million insecticide-treated bed nets through the child welfare clinics and antenatal clinics in health facilities in Ghana, and 26 million insecticide-treated nets through the point mass distribution.
During these exercises, they are also educated on the proper use of the nets and the proper care for the nets.
Many Ghanaians have benefited from the President's Malaria Initiative, VectorWorks Ghana activities.
The net will help my family and I a lot.
The PMI VectorWorks Ghana remains a leading funding agency for insecticide-treated bed nets in Ghana.
Performance so far has been great, but then our measure is the level to which people still suffer from malaria today. And I think that there is a big improvement, and the National Malaria Control Program can attest to that.
Social-cultural practices and the environment within which we live impact the longevity of the insecticide-treated nets distributed in communities. To observe this, PMI VectorWorks Ghana, in partnership with the Noguchi Memorial Institute for Medical Research, commissioned a durability study on the nets distributed in the Zabzugu and Nanumba South districts in the northern region during the mass campaign in June 2018.
In this study, we're looking at 2 different brands, one that was distributed in Zabzugu and one that was distributed in Nanumba South. So we're also looking to see if there's one brand that in this particular climate actually does better. In addition, we're looking at some of the behavioral variables. How do people store the net? How do they care for the net? And we're trying to determine if there are certain areas maybe that could be focused on in the future when we do behavior change campaigns.
In a fight against malaria, partnerships are important.
We work with other USAID partners, and we work with the district's health management teams, the regional health management teams, all of the Ghana Education Service.
We are very grateful to VectorWorks for promoting malaria prevention in our primary schools, and especially for the development of the communication guide for teachers.
Throughout the years, they've come out very committed, very getting the task done. They actually always keep us on our toes to make sure that we get to where we all said we will get to.
Of course, I cannot leave out the community opinion leaders. We engage very closely with the teachers at the schools. We work with assemblies when we're doing the mass campaigns, and we have supported the NMCP extensively for all the mass campaigns that they have carried out. Coordination and partnership engagement at various levels, so that at the end of the day, all these exercises go on very successfully.
The PMI VectorWorks Ghana insecticide net distribution has contributed immensely to the reduction of malaria cases in Ghana.